You're listening to Med School Radio.
We're back with another episode of Med School Radio, looking at MedBullet Step 1. This time we're looking at GI bleeds. We're going to look at an upper GI bleed. I am simply reading the MedBullets article on upper GI bleed. Then in the next podcast, we will look at lower GI bleeds. Okay, let's take a look at this snapshot. A 65-year-old man with a history of alcoholism, tobacco use, and hypertension presents to the ER with one episode of bloody emesis that occurred along with abdominal pain. He states that recently his stools have been black. Examination reveals spider angiomas, but no palmar erythema or hepatosplenomegaly. An upper endoscopy was performed. And they have a nice image for you on the right. Okay, introduction. Clinical definition. A bleed from a source proximal to the ligament of Treitz. Epidemiology. Incidence. 1 out of 1,000 people will experience an upper GI bleed. Upper GI bleeds are 4 times more common than lower GI bleeds. What are the risk factors? Alcohol consumption, cigarette smoking, liver disease, NSAIDs, vomiting, and anticoagulation. What is the etiology? Peptic ulcer disease, gastritis, esophageal varices in the setting of liver disease, Mallory-Weiss tears, Boerhaave syndrome, gastric cancer, vascular abnormalities, and esophagitis. What is the prognosis? The mortality rate is 6 to 10% overall. The presenting symptoms: hematemesis, which is a kind of coffee ground emesis, hematochezia, hypotension, and melanotic stools. Physical exam: abdominal pain, anorexia, bloody emesis. Imaging: upper and lower endoscopy is the definitive study to confirm the diagnosis, and angiography can be used to localize the source of a bleed and potentially intervene. Studies: labs include CBC, BMP, PT, INR, PTT, and liver studies. And you might have a normal hematocrit, which is not an accurate measure of blood loss. Hematocrit is not an accurate measure of blood loss. Studies: nasogastric tube. This will decompress the stomach and help to assess the color of the output. Rectal exam and fecal occult test to assess for lower GI bleeding. And you may need to intubate the patient to